As I approached retirement in 2000, I was looking for some way to stay involved in medicine, particularly in surgery.
One day, out of the blue, he called me and said he wanted to volunteer. And at that time, he was the first surgeon to ever express any interest in volunteering at Crossover. He added a new dimension to the comprehensive type of care that we provide at the clinic.
My first impression was I walked in through the patient door, just as a patient would, and went to the receptionist and introduced myself and was ushered in. It was small, it was crowded, it was busy, which I like.
With Dr. Darden coming to Crossover, we have been able to pass to him all the minor office surgical procedures that he can do much better, and has even been able to expand upon that. And this has allowed primary care doctors to concentrate more on the complicated primary care patients.
I have no real major operating room, and so I do minor surgery. Many of the procedures are things that would have required a trip to an emergency room or a physician's office, and I'm able to do it at the clinic.
He's so compassionate, he's so understanding, he's so patient. It's not only with the patient, it's with everyone. It's a relief for the people when they said, oh, Dr. Darden is going to do this small surgery for me.
These patients have been the most gratified of any that I remember seeing at any time in the past. They rarely ever fail to thank me personally as they leave the room or as I leave the room.
Dr. Darden's sense of humor is dry and witty. It's subtle.
I found that humor is a great tool in relieving pain, humor and or diversion in any form. And if I'm able with the language barrier to get through to the patient, sometimes I can divert their attention away from what I'm doing to them. And that's a big help.
He loves to help people. He's a great man, a great surgeon, and I feel blessed to be assisting him.
Well, it's gratifying to take care of somebody who comes in with a problem. It may be a minor problem, but it's a big problem to them. I really do feel that there's a need for the services, and that the clinic in many respects meets that need.